Can one of you take a moment and just kind of explain the herd immunity concept and how does that fit into the effectiveness of vaccinations?
Herd immunity applies to a population. What it means is that there's enough people in the population who are immune to a disease that when the disease comes, there's not enough people for transmission to occur and to have an outbreak. You can become immune from either having the infection or you could get it from a vaccine.
It's a pediatrics term, and it's really a mythical beast because it was always assumed, particularly by the 50s and 60s, when there was mandatory vaccinations and a whole panel, not just one or two vaccinations for kids to get into school. And you could not get into kindergarten, public or private, in this state and many states in the union without a little passport that was signed by a pediatrician that you got all three of your polios or all, whatever, and that had to be filled out. Well, back then you assumed that your community of kids had a lot of immunity to measles or what have you, because 95 or more % of the population of kids had vaccines. Now it's not quite so easy. In some places like Orange County, California, fewer than 50% of the kids were immunized against measles because of old, outdated, and completely wrong data that connected it to autism. Ladies and gentlemen, everyone else in the audience, autism is not connected to the measles vaccine in any way, shape, or form. And the guy who said that, a man named Wakefield, was listed by Time magazine as one of the worst scientists in the history of science. How would you like to have that as your appellation? And he deserves it, but it's caused a lot of problems. And measles, as one of the other physicians mentioned, is a very serious disease. But in the real field, particularly for like influenza or other things, we never achieve herd immunity, either by the people who've gotten sick and the number of people who've gotten vaccinated. But for this one, I know you can't twist people's arms. You have to answer questions. I think all of us are here to do this, as all of your healthcare professionals are. But my hope is that as many people out there who are listening, please, please, please get vaccinated.
People have side effects and reactions, and even unfortunately, there's been some that have died related to getting vaccines. But if you look at the overall picture, they're so important in terms of preventing for a full population, for everybody. They can prevent so much illness, so much death related to some of these just tragic infections that are there. I think the thing for us as medical providers, and I know for myself speaking for Chaz, is I think we need to make sure that we understand the benefits, but we also have to understand the anxieties that may be coming from our patients and from our communities. So I think we've made some errors in the past, I think, in some of the, the messaging that we've given, and we just have to be a part of, hey, how do we support our community? And when they're ready to do the vaccine, we want to make sure that they can do it. Explain all the information that we're going to do today so people feel safe and understand the benefits of the vaccines. But I think in the end, we are closest to the patients that we take care of, and we want to kind of explain our reasons for why we think it's important for all of us.
The proof is in the pudding, is in the tasting, really, because we've vaccinated billions of children with these vaccinations, the various vaccinations we give, without any serious or untoward effects. And even with this new vaccine that we're developing, with the first vaccine for an RNA virus, and it's been developed in only a year, has been shown to be, the various versions of it, very safe. And even the one that was pulled off the market temporarily, the AstraZeneca, because of the few cases of blood clots, you have to remember those were 2 or 3 cases among millions and millions of doses. So what we have learned in the long history, how am I doing for time, by the way, because I'm not looking at a clock. Well, I've got a few minutes. In the long history of vaccinations, the 300-year history of vaccinations, I could look everybody in the eye as a physician and as a historian of infectious disease, that if you had to list the top 10 greatest hits of the history of medicine, the greatest achievements, 9 of them would be the various vaccines we give. Maybe 10 of them would be. I may be underestimating it. And this COVID vaccine developed in such a quick fashion. only 10 to 12 months. That's a world's record, is truly remarkable. But we don't give vaccines unless they're shown to be safe, and we monitor them very carefully in case anything happens, which is what we are doing now. And I look forward to a robust discussion. But as a pediatrician, okay, who has given thousands of shots in my career, okay, until I learned the trick of having a nurse do it so the kids didn't hate me. But I've given thousands of shots in my career. I can honestly say, and the studies have shown, they have saved literally hundreds and hundreds of millions of lives. And these diseases are not good diseases to contract. They are very dangerous, they are very deadly, and they can damage organs in your body even if you survive them. And we're learning that about COVID as well.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.